The first step in the primary assessment is the general impression, which is determined while approaching the patient. Since the general impression is formed rapidly before contact has been made with the patient, it focuses on obvious signs, such as whether or not the patient appears to be conscious and breathing. Obvious abnormalities, such as skin discoloration or bodily fluids, should also be included in the general impression. Overall, a poor general impression is any assessment that indicates a priority patient based on the initial signs visible on approach. Airway obstruction is a major preventable cause of death in medical and trauma emergencies alike. Assessing a conscious patient's airway begins with talking to the patient. If they respond easily to questions, their airway can be considered patent. If the patient is not adequately protecting their airway, an airway adjunct such as an NPA or OPA should be considered. Note that an OPA should only be used in the case of an unconscious patient without a gag reflex. Snoring respirations indicate that a patient's airway is being partially obstructed by their tongue, and their airway may need to be repositioned with a head tilt chin lift or jaw thrust maneuver depending on circumstance. If the patient has gurgling respirations, suction should be used. Once the airway is secured or being maintained by the patient, breathing and ventilation should be assessed for effectiveness. Inadequate breathing, along with any signs of hypoxia, should be treated with oxygen therapy and a non-rebreather mask. If the patient is apneic or bradypneic, you should administer assisted ventilations with a BVEM. The assessment of circulation focuses on whether the patient's tissues are being adequately perfused and looking for signs of shock. In medical calls, be alert to signs of myocardial infarction. In trauma, this is looking for and controlling hemorrhage that has not been previously controlled. Treatment for life-threatening hemorrhage includes, among other more specialized treatments, the use of dry sterile gauze and potentially a tourniquet. Responses to other parts of your initial assessment may give you some indication of the patient's level of consciousness. If a patient cannot correctly answer simple questions, has a loss of motor ability or sensation in the extremities, has pupils that are not equal round and reactive, or is exhibiting signs of a stroke, you should initiate oxygen therapy and transport immediately to a stroke center.